Preface. Welcome to Keto Uncomplicated and Extended Fasting, the definitive guide, nutrition, recipes, and strategies for success. This book has been created to serve as a comprehensive and practical resource on the ketogenic diet, offering a clear and accessible path for those who wish to explore or deepen their knowledge of this transformative dietary approach. The ketogenic diet has gained popularity not only for its effectiveness in weight loss, but also for its potential benefits for metabolic and mental health. However, with so much information available and varying interpretations of this diet, it can be challenging to find a reliable guide that meets your individual needs. With this in mind, we developed this book to provide a complete resource that combines theory and practice, supporting you on your ketogenic journey. Here, you will find a detailed exploration of the principles of the ketogenic diet, from understanding macronutrients and the importance of ketosis to practical strategies for overcoming common challenges. The inclusion of a wide range of recipes, from simple everyday dishes to more elaborate options for special occasions, has been carefully designed to facilitate adherence to the diet and contribute to your success. Additionally, this guide is part of the LGS protocol, the Leaky Gut Syndrome Protocol, created by Dr. Eduardo Beltran, as many patients who have adopted this diet also present with intestinal hyperpermeability, a condition often observed in various autoimmune diseases, metabolic disorders, and different types of cancer. By integrating this diet with other approaches from the LGS protocol, we have observed significant improvements in these patients' intestinal health and quality of life. The focus on low-carbohydrate vegetables and the exclusion of certain dairy products and lectins reflects an approach tailored to these conditions, offering an inclusive and personalized solution for diverse dietary needs and preferences. As you progress through the chapters, you will find evidence-based information, best practices, and helpful tips to maximize the benefits of the ketogenic diet. We believe that with the knowledge and tools provided, you will be well prepared to adopt and maintain a ketogenic diet that supports your long-term health and well-being. I wish you success on your ketogenic journey and hope that this guide becomes a valuable resource in your quest for a healthier and more balanced life. Introduction. We live in an era of abundant information about health and wellness, but often the complexity of these topics can be overwhelming. Among the most discussed nutritional approaches today are the ketogenic diet and extended fasting, both widely promoted for their potential health benefits. However, the practical implementation of these strategies can seem challenging without clear and accessible guidance. In Keto Uncomplicated and Extended Fasting, my goal is to provide a straightforward and practical approach to two of the most powerful health optimization tools. Based on years of clinical experience and in-depth research, I present a guide that makes the ketogenic diet and extended fasting not only understandable but also applicable to your daily life. This book is a synthesis of the most relevant aspects of nutrition science and integrative medicine, with a special focus on how these practices can promote metabolic health, improve brain function, and support bodily recovery. We will demystify the rules and concepts behind the ketogenic diet and extended fasting, covering everything from the scientific foundations to practical application and adaptation strategies. Here, you will find not only the theory but also practical tools, meal plans, and valuable tips to effectively and sustainably integrate these practices into your routine. This book is for those who wish to explore new ways to optimize their health and well-being, simplifying complex concepts so they can be applied directly and efficiently. Prepare for a transformative journey that not only clarifies but also inspires the adoption of nutritional practices that can lead to a healthier and more balanced life. Let's start uncovering the secrets of the ketogenic diet and extended fasting, and how they can be your allies in the pursuit of lasting well-being. With gratitude, Dr. Eduardo Beltran, creator of the LGS Protocol, 1st edition, 2024. Chapter 1. Introduction to the ketogenic diet. What is the ketogenic diet? The ketogenic diet, or keto diet, is a nutritional approach that prioritizes the intake of fats, with moderate amounts of protein and a drastic reduction in carbohydrates. The goal of this diet is to induce a metabolic state called ketosis, where the body begins to use ketones, derived from fat, as its main source of energy instead of glucose. This concept of ketosis is fundamental because when carbohydrate intake is drastically reduced, insulin levels drop, forcing the body to convert fatty acids into ketones in the liver. This process provides efficient energy for the brain and other organs, contributing to a range of metabolic benefits. History and origins of the ketogenic diet. The ketogenic diet emerged in the early 20th century as a therapeutic intervention for the treatment of epilepsy, particularly in children who did not respond to anticonvulsant medications. In the 1920s, doctors discovered that inducing ketosis could significantly reduce the number and severity of epileptic seizures. Over time, the diet was adapted for other clinical conditions such as type 2 diabetes, obesity, cardiovascular diseases, neurodegenerative disorders like Alzheimer's and Parkinson's, and even as an adjunct treatment for cancer. In recent years, the ketogenic diet has gained popularity among the general public, mainly due to its success in weight loss, appetite control, and improvement in mental performance. Different types of ketogenic diets. Although the basic concept of the ketogenic diet remains the same, there are several variations that can be adapted for different goals and needs. Standard ketogenic diet (SKD). This is the most common version, consisting of about 75% fats, 20% proteins, and 5% carbohydrates. It is ideal for those seeking to enter ketosis to achieve weight loss and metabolic optimization benefits. Cyclical ketogenic diet (CKD). This alternates periods of ketogenic eating with days of high carbohydrate intake. It is popular among athletes who want to combine the benefits of ketosis with the temporary energy boost provided by carbohydrates. Targeted ketogenic diet (TKD). This involves consuming carbohydrates around intense workouts to ensure extra energy during physical activity without disrupting ketosis at other times. High-protein ketogenic diet, a variation where protein intake is increased, with approximately 60% fat, 35% protein, and 5% carbohydrates. It is often used by people looking to maintain or gain muscle mass while in ketosis. The science behind ketosis. When the body is deprived of carbohydrates and glycogen stores are depleted, it begins to metabolize stored fat, converting it into fatty acids and ketones. The ketones are then used as the primary energy source, particularly by the brain, which normally relies on glucose. This metabolic state is highly efficient for fat burning, as the body becomes more adapted to using fats as fuel. Studies show that ketosis has a positive impact on brain function, promoting greater mental clarity and concentration. Additionally, ketosis can help stabilize blood sugar levels, improve HDL cholesterol levels, the good cholesterol, and reduce triglyceride levels. Chapter Objectives. The objective of this chapter is to provide a clear understanding of what the ketogenic diet is, its origins, and how it works in the body. Understanding this foundation will allow readers to make informed decisions about whether the ketogenic diet is suitable for their health and wellness goals. In the upcoming chapters, we will delve into specific benefits, practical implementation, and the nuances of the ketogenic diet. End of Chapter 1. Benefits of the ketogenic diet. The ketogenic diet stands out for its widely positive effects on metabolic health and the management of various medical conditions. In this chapter, we will explore the main benefits of this diet and how it impacts the body in a multifaceted way. Weight loss and appetite control. One of the most well-known benefits of the ketogenic diet is rapid and sustainable weight loss. This occurs because in ketosis, the body becomes a fat-burning machine. Numerous studies have shown that people on a ketogenic diet lose more weight and more quickly than those on low-fat diets. Additionally, the ketogenic diet helps with appetite control. The high intake of fats and proteins promotes greater satiety, reducing the need for frequent snacks and constant hunger, factors that often sabotage traditional diets. Blood sugar control and type 2 diabetes prevention. The ketogenic diet can have a significant impact on blood sugar control and insulin sensitivity, making it an effective tool in the prevention and management of type 2 diabetes. By drastically reducing carbohydrate intake, the body requires less insulin to keep blood sugar levels stable. This reduces stress on the pancreas and decreases insulin resistance. Research shows that ketogenic diets can not only stabilize blood sugar levels, but also, in some cases, lead to the complete remission of type 2 diabetes. Patients who follow the diet under medical supervision may be able to reduce or even eliminate the need for glucose-controlling medications. Impact on cardiovascular health. Contrary to the myth that fat consumption increases the risk of cardiovascular diseases, the ketogenic diet has been shown to improve heart health markers. Studies indicate that the diet increases HDL cholesterol levels, the good cholesterol, reduces triglyceride levels, and improves the LDL-HDL ratio, all factors associated with a lower risk of heart disease. Furthermore, the weight loss promoted by the ketogenic diet, particularly the reduction of visceral fat around the organs, contributes to improved cardiovascular health by lowering blood pressure and enhancing vascular function. Effects on brain function and mood. Ketosis offers significant benefits for mental health and brain function. Ketones are a more efficient energy source for the brain than glucose, promoting greater mental clarity, focus, and memory. This is particularly relevant for individuals suffering from neurological disorders such as epilepsy, Alzheimer's, and Parkinson's disease. Additionally, the ketogenic diet can help stabilize mood. Studies suggest that ketosis has mood-stabilizing effects and may be helpful in treating mood disorders such as depression and anxiety by regulating neurotransmitters and reducing brain inflammation. Anti-cancer potential and support for autoimmune disease treatment. One of the most promising areas of research on the ketogenic diet is its potential as an adjunctive therapy in cancer treatment. The premise is that cancer cells rely more on glucose to grow and multiply than normal cells. By drastically reducing the body's glucose supply and forcing cells to rely on ketones for energy, the ketogenic diet may help slow the growth of tumors. Additionally, the ketogenic diet may be useful in managing autoimmune diseases. Chronic inflammation is at the core of many autoimmune conditions, and ketosis has been shown to reduce inflammatory markers in the body. Combined with an anti-inflammatory diet and proper supplementation, ketosis may help modulate the immune system and alleviate symptoms of autoimmune diseases such as lupus, multiple sclerosis, and rheumatoid arthritis. Other benefits of the ketogenic diet. Improvement in digestive health. By reducing the intake of refined carbohydrates and sugars, the ketogenic diet can help improve gut health, reduce inflammation in the digestive tract, and relieve symptoms of disorders such as irritable bowel syndrome, IBS, and inflammatory bowel disease, IBD. Increased energy and physical endurance. Once adapted to ketosis, the body becomes more efficient at using fats as fuel, which can enhance physical endurance, especially in long-duration activities. Protection against neurodegenerative diseases. Research suggests that the ketogenic diet may protect against cognitive decline associated with aging, including diseases like Alzheimer's and Parkinson's. By providing an alternative energy source for the brain and reducing neural inflammation. Conclusion. This chapter has demonstrated how the ketogenic diet goes beyond weight loss, offering a wide range of benefits for metabolic, cardiovascular, and mental health, as well as for the treatment of serious conditions such as cancer and autoimmune diseases. The ketosis-based approach is not just a tool for weight management, but a powerful intervention for overall health, with a profound impact on various aspects of well-being. In the upcoming chapters, we will explore how to implement the ketogenic diet effectively, tailor it to different goals and needs, and the nuances of adapting to ketosis. End of Chapter 2. Chapter 3. The role of fats in the ketogenic diet. Fats play a crucial role in the ketogenic diet, serving as the primary source of energy for the body in a state of ketosis. This chapter explores the importance of fats, the different types that exist, the foods that are healthy sources of these fats, and debunks some misconceptions about fat consumption. Importance of fats as a primary source of energy. In the ketogenic diet, carbohydrate intake is reduced to a very low level, which forces the body to find a new energy source. Instead of using glucose from carbohydrates, the body starts using fats as fuel. This process, known as ketosis, converts fats into ketones in the liver, which are then used as efficient energy by the brain, muscles, and other organs. The main advantage of this process is that fats provide a more stable and sustained energy compared to carbohydrates, avoiding blood sugar spikes and energy crashes. Additionally, burning fats can promote weight loss and help regulate appetite. Types of fats: saturated, unsaturated, and trans. To better understand how fats work in the ketogenic diet, it is important to differentiate between the main types of fats. Saturated fats, found in foods such as red meat, butter, cheese, and coconut oil. For many years, saturated fats were demonized for supposedly increasing the risk of heart disease. However, more recent research suggests that moderate consumption of saturated fats can be part of a healthy diet, especially in the context of low carbohydrate intake. Unsaturated fats: these are divided into monounsaturated fats found in olive oil, avocado, and nuts, and polyunsaturated fats present in fatty fish, seeds, and vegetable oils. These fats are often referred to as good fats due to their proven benefits for heart and brain health. Trans fats: these are artificially produced fats found in processed foods like margarine, fast food, and some cookies. Trans fats are associated with an increased risk of heart disease and inflammation and should be avoided as much as possible in any diet, including ketogenic. Foods rich in healthy fats. To maintain a healthy and balanced ketogenic diet, it is crucial to choose high-quality fat sources. Some of the best foods rich in healthy fats include avocado, rich in monounsaturated fats and fiber. Avocado is an excellent choice for providing energy and maintaining satiety. Coconut oil contains medium-chain triglycerides, MCTs, which are rapidly metabolized by the body and help promote ketosis. Fatty fish, salmon, sardines, and mackerel are rich in omega-3 fatty acids, which have anti-inflammatory properties and cardiovascular health benefits. Nuts and seeds: almonds, walnuts, chia seeds, and flax seeds are good sources of healthy fats, as well as providing fiber and micronutrients. Extra virgin olive oil, a cornerstone of the Mediterranean diet. Extra virgin olive oil is excellent for cooking and dressing salads, providing healthy monounsaturated fats. Ghee and quality butter. When sourced from grass-fed animals, these are rich in beneficial fatty acids and can be used for cooking or as part of meals. Myths and realities about fat consumption. The consumption of fats is surrounded by a number of myths and misunderstandings. Here, we debunk some of the most common misconceptions. Myth 1. Saturated fats cause heart disease. Although it has been suggested that saturated fats increase cholesterol levels and thus the risk of heart disease, recent studies indicate that this relationship is not so straightforward. In fact, consuming saturated fats in a low-carbohydrate diet may not have the same adverse effects as in a high-carbohydrate diet. Myth 2. All fats are the same. The quality of fat is crucial. Trans fats are harmful. While saturated and unsaturated fats play important roles in health, especially when consumed in balance. Myth 3. Eating fat makes you fat. In fact, consuming fats in a ketogenic diet can aid in weight loss by promoting greater satiety and reducing insulin spikes, which are a major factor in fat accumulation. Myth 4. The ketogenic diet is high in unhealthy fats. Many people assume that the ketogenic diet is solely based on excessive consumption of meats and saturated fats. However, a healthy approach to the ketogenic diet involves including a wide variety of healthy fats, such as those found in avocados, olive oil, and fish. Conclusion: fats are central to the ketogenic diet, providing the energy needed for the body to function efficiently in a state of ketosis. By understanding the different types of fats and choosing healthy sources, it is possible to maintain a balanced and healthful ketogenic diet. In the next chapter, we will explore how this metabolic shift impacts overall health and how it can be used to manage various medical conditions. End of Chapter 3.
Chapter 4. The role of proteins and carbohydrates in ketosis. Proteins' ideal amount and recommended sources. Importance of proteins in the ketogenic diet. Proteins are essential for tissue repair and construction, enzyme and hormone production, and muscle maintenance. In a ketogenic diet, the goal is to balance protein intake to support overall health without compromising ketosis. Ideal protein amount. Caloric distribution. In a typical ketogenic diet, proteins should make up about 20 to 25% of total daily calories. This helps ensure that the body has enough protein for vital functions without exceeding the amount that could be converted into glucose. Individual needs. The ideal amount may vary based on factors such as physical activity level, age, and specific goals. For example, athletes or individuals looking to gain muscle mass may need a higher amount of protein. Recommended protein sources. Meats. Prefer fresh, unprocessed meats such as beef, chicken, pork, and lamb. Avoid processed meats that may contain added sugars and preservatives. Fish and seafood. Opt for fatty fish like salmon, tuna, and sardines, which not only provide high-quality protein but also beneficial omega-3 fatty acids. Eggs. Eggs are a complete protein source, containing all essential amino acids. They are also rich in nutrients and can be prepared in various ways. Dairy. Hard cheeses, such as cheddar and Parmesan, full-fat yogurts, and cream are good sources of protein and fats. However, it's important to monitor carbohydrate content, especially in processed products. Plant-based sources. Tofu and tempeh are options for vegetarians or vegans, but care should be taken with their carbohydrate content. How to limit carbohydrate intake. General guidelines. To enter and maintain ketosis, it is essential to reduce carbohydrate intake. The body must be in a state of ketosis for fats to be used as the primary energy source instead of glucose. Recommended daily amount. Carbohydrate limit. Generally, intake should be limited to less than 20 to 50 grams of net carbohydrates per day. This varies depending on individual metabolism and activity level. Continuous monitoring. Keeping a food diary can help track and adjust carbohydrate intake as needed. Strategies for limiting carbohydrates. Choose low-carb foods, prioritize foods that are low in carbohydrates, and avoid those high in sugars and starches. Meal preparation. Cooking at home allows for more precise control over ingredients and carbohydrate levels in your meals. Read labels. Check product labels to identify carbohydrate content and choose options with fewer net carbohydrates. List of allowed and forbidden foods in the ketogenic diet. Allowed foods. Meats and fish includes fresh meats such as beef, chicken, pork, and fish. Prefer unprocessed cuts. Eggs, a versatile source of protein and healthy fat. Dairy, whole cheeses, cream, and butter. Check carbohydrate content in processed dairy products. Low-carb vegetables, spinach, kale, broccoli, cauliflower, zucchini, asparagus, and cucumber are high in fiber and low in carbohydrates. Healthy fats. Coconut oil, olive oil, butter, and avocado are sources of healthy fat that support ketosis. Forbidden foods. Grains and starches. Products like bread, rice, pasta, and cereals should be avoided due to their high carbohydrate content. Fruits. Fruits generally contain natural sugars. It is better to avoid fruits such as bananas, apples, oranges, and grapes. Some fruits like strawberries and raspberries can be consumed in moderation. Sugars and sweets includes sugar, sodas, and processed sweets. They can cause glucose spikes and interrupt ketosis. Legumes, beans, lentils, and chickpeas are high in carbohydrates and should be avoided on a ketogenic diet. The impact of net carbohydrates. Definition of net carbohydrates. Net carbohydrates are the amount of carbohydrates that affect blood glucose levels. They are calculated by subtracting dietary fiber and non-digestible sugar alcohols from the total carbohydrates. Importance in the ketogenic diet. Impact on metabolism. Net carbohydrates can raise blood glucose levels and disrupt ketone production. Therefore, it is crucial to monitor and limit net carbohydrate intake to maintain ketosis. Label reading and calculation. Check food labels to identify the total carbohydrates and subtract fiber and sugar alcohols to determine net carbohydrates. Examples of foods and drinks with net carbohydrates. Drinks, sweetened beverages, such as sodas and fruit juices, contain high levels of net carbohydrates. Processed foods, packaged and processed foods, often have added sugars and carbohydrates that can be difficult to identify. Conclusion. To effectively achieve and maintain ketosis, it is crucial to balance protein intake and limit carbohydrate intake. Understanding the ideal amount of protein, limiting net carbohydrates, and identifying allowed and forbidden foods are essential steps for a successful ketogenic diet. With careful planning and continuous monitoring, it is possible to achieve and sustain ketosis effectively. End of Chapter 4. The science of ketosis and GKI. How ketosis works in the body. The concept of ketosis. Ketosis is a metabolic state in which the body, instead of using glucose as its primary source of energy, starts to use ketone bodies, which are produced from the breakdown of fatty acids in the liver. This process occurs when carbohydrate intake is drastically reduced, forcing the body to seek alternative energy sources. Mechanism of ketosis. Reduction of glucose. When carbohydrate intake is very low, blood glucose levels decrease, which reduces the release of insulin. Production of ketone bodies. With reduced insulin levels, the liver begins to convert fatty acids into ketone bodies, acetoacetate, beta-hydroxybutyrate, and acetone. These ketone bodies are released into the bloodstream and used as fuel by cells, especially by the brain and muscles, replacing glucose. Benefits of ketosis. Fat burning. Ketosis can promote the burning of body fat, as the body uses fat reserves to produce ketone bodies. Improved mental clarity and energy. Many report improvements in mental clarity and energy levels, as the brain efficiently uses ketone bodies. Appetite control. Ketosis can help control appetite and reduce calorie intake, due to the satiating effect of fats and ketone bodies. The glycemic ketosis index and its importance. What is the glucose ketosis index, also known as the glucose ketone index, or GKI? The glycemic ketosis index is a classification system that evaluates the relationship between blood glucose and ketone levels. It is used to monitor the effectiveness of the ketogenic diet and ensure that the body is in an optimal state of ketosis. When using capillary blood glucose units in milligrams per deciliter, it must be converted to millimoles per liter by dividing the value of milligrams per deciliter by 18, which is a constant. Here is a brief overview. To calculate the glucose ketone index, you need two key measurements: blood glucose and blood ketones. Let's say your blood glucose is 90 milligrams per deciliter. You divide that by 18, which gives you 5 millimoles per liter. Now you have your blood glucose in the correct unit, which is millimoles per liter. Once you have both numbers in millimole per liter, the formula for the GKI is simple. GKI equals blood glucose millimoles per liter divided by blood ketones in millimoles per liter. Imagine your blood glucose is 5 millimoles per liter and your blood ketones are 1.5 millimoles per liter. Now divide both numbers, and that gives you glucose ketone index that equals 3.33. It's that easy. Interpretation: the resulting value indicates the level of ketosis the body is in. Lower values indicate deeper and more effective ketosis. Importance of the GKI. Assessment of ketosis. The GKI provides a precise view of how effectively the body is in ketosis, helping to adjust diet and habits to maintain optimal ketosis. Monitoring metabolic health. Maintaining an appropriate glycemic ketosis index can have positive implications for metabolic health, weight control, and cognitive performance. How to measure ketosis and GKI at home. Measurement methods. Glucose meters, used to measure blood glucose levels. These meters are similar to those used by individuals with diabetes. Ketone meters, specific devices measure ketone levels in the blood, breath, or urine. Blood ketone meters are the most accurate. Measurement procedures. Measure glucose, perform a finger prick, and use a glucose meter to obtain your blood glucose level. Measure ketones. Use a ketone meter to measure the concentration of beta-hydroxybutyrate in the blood or the level of ketones in the urine. Calculate GKI. Enter the glucose and ketone values into the GKI formula, as explained previously, in order to obtain the result. Tips for effective measurement. Consistent timing. Measure at the same time each day to ensure consistent results. For more accurate readings, it's advisable to measure glucose and ketone levels while fasting or before eating. Keeping GKI below 3. Fasting and carbohydrate restriction. Intermittent fasting and the benefits of fasting. Fasting can help keep the GKI below 3 by promoting ketone production and improving insulin sensitivity. It may also aid in reducing overall calorie intake. Common protocols include a 16-hour fast with an 8-hour eating window, or a 24-hour fast on alternate days depending on individual tolerance. Carbohydrate restriction. Carbohydrate intake. Maintaining very low carbohydrate intake, less than 20 to 50 grams of net carbs per day, is essential to keep the GKI below 3 and ensure ongoing ketosis. Food choices. Focus on foods rich in healthy fats and proteins, and avoid high carbohydrate foods such as grains, sugars, and legumes. Strategies for maintaining GKI. Diet adjustment. Continuously monitor your food intake based on GKI results. Adjust your carbohydrate and fat consumption to optimize ketosis, ensuring that the GKI remains within optimal levels. Regular monitoring. Consistently measure glucose and ketone levels to ensure that the GKI stays within the desired range. Adjust your diet and fasting regimen as needed to maintain a GKI below 3. Conclusion. Understanding the science behind ketosis and the glycemic ketone index is essential for optimizing the results of a ketogenic diet. Keeping the GKI below 3 through intermittent fasting and strict carbohydrate restriction can offer significant health and wellness benefits. Adopting a careful and strategic approach to monitoring and adjusting your diet allows you to maximize the effects of ketosis and effectively achieve your health goals. At the end of this chapter, you will find a chart that displays the ketosis classification. Each GKI level corresponds to a specific metabolic state. Use this classification as a tool to help optimize and keep track of your state of ketosis. End of Chapter 5. Chapter 6. How to implement the ketogenic diet. Now that you understand what the ketogenic diet is and its various benefits, the next step is to learn how to implement it effectively. This chapter will be a practical guide to help you start your ketogenic journey, focusing on meal planning, food choices, adaptation phases, and long-term success strategies. Meal planning for the ketogenic diet. The foundation of a successful ketogenic diet is careful meal planning, which involves drastically reducing carbohydrates, increasing the intake of healthy fats, and moderating protein consumption. Macronutrient distribution. Fats. 70 to 80% of daily calories should come from fats. Foods like avocado, olive oil, coconut oil, butter, nuts, and seeds are excellent sources. Proteins. 15 to 25% of daily calories should come from proteins. Choose lean meats, fatty fish, eggs, and moderate amounts of dairy. Carbohydrates. Only 5 to 10% of daily calories should come from carbohydrates, limiting them to approximately 20 to 50 grams per day. These carbohydrates should come from sources like leafy greens and other non-starchy vegetables. Food choices. Allowed foods. The focus should be on whole foods that are rich in healthy fats and low in carbohydrates. This includes meats, fish, eggs, cheese, casein, nuts, seeds, oils, low-carb vegetables like spinach, cauliflower, and zucchini, and avocados. Foods to avoid: sugars, grains, processed foods, legumes, fruits except for small amounts of berries, and starchy foods like potatoes and pasta should be avoided. Strategies to avoid common pitfalls. Read food labels. Be vigilant about hidden carbohydrates in packaged foods. Plan meals ahead. Planning your meals in advance helps you avoid impulsive food choices that may derail your progress. Stock healthy keto snacks. Keep keto-friendly snacks like nuts or hard-boiled eggs on hand to resist the temptation to consume carbs. Adapting to the ketogenic diet, transition phase. The transition to ketosis can be challenging for some people. During the first few days or weeks of the ketogenic diet, you may experience symptoms known as the keto flu. These symptoms can include fatigue, headaches, irritability, dizziness, nausea, and muscle cramps. These are temporary and usually subside as your body adjusts to ketosis. Increase electrolyte intake. When carbohydrates are reduced, insulin levels drop, and the body excretes more sodium and water. This can lead to dehydration and electrolyte loss, contributing to keto flu symptoms. Increase your intake of salt, potassium, and magnesium to help balance electrolytes. Stay hydrated. Drink plenty of water to prevent dehydration. Ketosis has a diuretic effect, so staying hydrated is essential. Be patient. Adapting to ketosis can take anywhere from a few days to several weeks, depending on the individual. Give your body time to adjust and stay focused on the long-term benefits. Tools for monitoring ketosis. To ensure you are following the ketogenic diet correctly and entering ketosis, it's useful to monitor the levels of ketones in your body. Here are 3 primary methods to do this. Urine strips. These strips measure the amount of ketones in the urine and are a cheap and easy way to start monitoring ketosis. However, accuracy may decline as the body adapts to the diet. Blood ketone meter, similar to a glucose meter. This device measures ketone levels in the blood. It's more accurate than urine strips but is also more expensive. Breath ketone meter. This method measures ketones in the breath and is less invasive than blood collection. Although more expensive initially, it's a convenient long-term option. Long-term ketosis maintenance. Maintaining ketosis requires consistency, but also flexibility to adjust your diet to meet your needs. Here are some strategies for long-term success. Intermittent fasting. Intermittent fasting pairs well with the ketogenic diet, accelerating ketosis and optimizing fat burning. Common protocols include the 16-8 method, 16 hours of fasting and 8 hours of eating. Adjusting macronutrients. As your body adapts to ketosis, you can tweak your intake of fats, proteins, and carbohydrates to align with your goals and individual response. Constant monitoring. Keep tracking your ketone levels and adjusting your diet as needed. Maintaining a food journal will help you record what works best for you, making it easier to fine-tune your ketogenic journey. Food variety. Keep your diet interesting by exploring new recipes and experimenting with different ketogenic foods. This will help avoid boredom and ensure you get a wide range of nutrients. Conclusion. This chapter has provided a step-by-step guide for implementing the ketogenic diet, from meal planning to adapting to ketosis and maintaining it long-term. Now that you're equipped with the necessary tools and strategies, you're ready to confidently and successfully begin your ketogenic journey. In the next chapters, we'll discuss how to personalize the ketogenic diet to meet different health goals, such as weight loss, improving athletic performance, or managing specific health conditions. End of Chapter 6. Chapter 7. Phases of adaptation to ketosis. Keto flu, symptoms, and how to deal with it. What is keto flu? Keto flu refers to a set of symptoms that can occur during the initial phase of adopting a ketogenic diet. These symptoms generally reflect the body's transition from using glucose as its primary energy source to using ketones derived from fats. Common symptoms: fatigue, feeling tired and low on energy, headache, mild to moderate headaches, nausea and vomiting, gastrointestinal discomfort, irritability, mood swings and difficulty concentrating, muscle cramps, weakness and muscle pain. Strategies to manage keto flu: adequate hydration, increase water intake, and consider consuming electrolyte drinks. Electrolyte replacement: include sodium, potassium, and magnesium in your diet. Gradual adaptation, slowly reduce carbohydrate intake to minimize symptoms. Rest, ensure adequate sleep and avoid intense physical activities during the initial phase. Supplementation, consider supplementation with electrolytes or specific medications if needed. Metabolic adaptation and increased energy efficiency. The metabolic adaptation process. During metabolic adaptation, the body transitions from using glucose to ketones as its primary energy source. This process can take from a few weeks to a few months, depending on the individual. Benefits of full adaptation. Increased energy, greater efficiency in using fat as fuel. Improved mental clarity, stable mental state, and better cognitive performance. Appetite control, reduced hunger and food cravings. Enhanced physical performance, increased endurance and athletic performance. Factors influencing adaptation. Duration of the ketogenic diet, the time required to achieve full adaptation. Level of physical activity, the impact of exercise on the speed of adaptation. Fat consumption, the quality and quantity of fats ingested. Individual metabolism, variations in individual response to the diet. Monitoring ketosis and dietary adjustments. Monitoring methods. Urine tests, using test strips to measure ketones in the urine. Blood monitoring, ketone meters in the blood for more precise measurement. Breath analysis, devices that detect ketones in the breath. Dietary adjustments, macronutrient adjustment, modifying the ratios of fat, protein, and carbohydrates as needed. Increasing fat intake, ensuring adequate consumption of healthy fats. Correcting nutritional deficiencies, supplementing essential nutrients to balance the diet. Strategies to maximize ketosis. Maintaining carbohydrate restriction. Monitoring and adjusting carbohydrate intake to ensure continued ketosis. Fasting cycles. Implementing fasting periods to boost ketone production. Calorie control. Adjusting caloric intake to optimize the results of the ketogenic diet. End of Chapter 7. Chapter 8. The ketogenic diet and metabolic health. Impact on insulin resistance and metabolic syndrome. What is insulin resistance? Insulin resistance is a condition where the body's cells do not respond effectively to insulin, leading to elevated blood glucose levels. This can contribute to the development of type 2 diabetes and other metabolic conditions. Effects of the ketogenic diet on insulin resistance. Reduction in blood glucose. The ketogenic diet can help stabilize blood glucose levels. Improvement in insulin sensitivity. Studies suggest that the ketogenic diet can enhance the cell's response to insulin. Appetite control. Lower insulin levels can lead to reduced hunger and better weight management. Metabolic syndrome. Metabolic syndrome is a cluster of conditions that includes hypertension, hyperglycemia, elevated triglycerides, and abdominal obesity. The ketogenic diet may help manage or even reverse these factors. Reduction in abdominal fat. The diet can aid in reducing visceral fat, a key marker of metabolic syndrome. Improvement in lipid profiles. Increase in HDL good cholesterol, and reduction in blood triglycerides. Blood pressure control. Possible reduction in blood pressure in individuals with hypertension. Effects on mitochondrial health and cellular function. The role of mitochondria. Mitochondria are cellular organelles responsible for producing energy in the form of ATP. Efficient mitochondrial function is crucial for overall health and metabolism. Impact of the ketogenic diet on mitochondrial health. Increased energy production. The ketogenic diet can enhance ATP production from ketone bodies. Reduction in oxidative stress. The diet may decrease the production of free radicals and improve antioxidant protection. Improved mitochondrial function. Studies indicate that ketosis can increase mitochondrial biogenesis and energy efficiency. Optimization of fat and ketone metabolism. Fat metabolism. The ketogenic diet is designed to enhance the body's ability to metabolize fats rather than glucose. Increased fat oxidation. Ketosis promotes the use of fatty acids as the primary source of energy. Reduction in fat storage. The diet can help minimize fat storage and encourage lipolysis fat breakdown. Production and utilization of ketones. Production of ketone bodies. The diet increases the production of ketones, including acetoacetate, beta-hydroxybutyrate, and acetone. Utilization of ketones by the brain and other tissues. Improved ability of tissues to use ketones as an alternative energy source to glucose. Strategies to optimize ketosis. Maintaining carbohydrate restriction. Ensure carbohydrate intake remains low to sustain ketosis. Adequate fat intake. Increase consumption of healthy fats to support ketone production. Monitoring and adjustments. Regularly assess ketone levels and adjust the diet as needed to maintain optimal ketosis. End of Chapter 8. Chapter 9. The ketogenic diet and autoimmune diseases. The ketogenic diet, which initially emerged as an intervention for the treatment of refractory epilepsy, has gained relevance in various areas of medicine, including the treatment of autoimmune diseases. This chapter aims to deepen the understanding of the mechanisms by which the ketogenic diet can act as a therapeutic tool in autoimmune conditions, covering everything from biochemical foundations to clinical application in specific diseases. The biochemistry of ketosis. As previously mentioned, ketosis is a metabolic state in which the body, instead of using glucose as its primary energy source, relies on ketone bodies, which are produced by the liver from fatty acids. The primary ketone body, beta-hydroxybutyrate (BHB), has anti-inflammatory and neuroprotective effects. By drastically reducing carbohydrate intake, the body depletes its glycogen stores, forcing the liver to convert fatty acids into ketones to fuel glucose-dependent tissues, such as the brain. This process not only promotes fat burning as a primary energy source, but also triggers a series of beneficial metabolic and hormonal responses, including the modulation of inflammatory pathways. Beta-hydroxybutyrate effects are not limited to cellular energy. It is also a potent inhibitor of inflammatory pathways, such as the NOD-like receptor pyrrin domain containing protein 3, also known as NLRP3 inflammasome, a protein complex involved in activating inflammatory responses. Inhibition of the NLRP3 inflammasome by beta-hydroxybutyrate has significant implications for controlling chronic inflammation present in autoimmune diseases. The connection between the gut and the immune system. In recent years, the role of the gut in the development and regulation of autoimmune diseases has been increasingly explored. The gut is home to trillions of bacteria that play crucial roles in digestion, vitamin synthesis, and immune system regulation. A central factor in the development of autoimmune diseases is dysbiosis, an imbalance in the composition of the intestinal microbiota. Dysbiosis can result in the disruption of the intestinal barrier, a phenomenon known as intestinal hyperpermeability, or leaky gut syndrome. When this barrier is compromised, particles such as toxins, bacterial antigens, and poorly digested food molecules can translocate into the bloodstream, provoking an inappropriate immune response and exacerbating autoimmune diseases. The ketogenic diet can play a crucial role in restoring the integrity of the intestinal barrier. Studies indicate that the ketogenic diet promotes the growth of beneficial commensal bacteria, such as Akkermansia muciniphila, which are involved in maintaining the intestinal mucosa. Additionally, the diet reduces the growth of bacteria that produce lipopolysaccharides, a bacterial toxin that activates the innate immune system and is associated with chronic inflammation. Immunomodulation by the ketogenic diet. Autoimmune diseases are characterized by a failure of the immune system to distinguish self-cells from external pathogens, resulting in attacks on healthy tissues. This immune dysregulation can be exacerbated by chronic inflammation and imbalances in immune cell populations. Beta-hydroxybutyrate, in addition to serving as an energy source, also has immunomodulatory properties. It regulates the balance between effector T cells, which drive immune responses, and regulatory T cells, also called Tregs, which suppress excessive immune responses. In many cases of autoimmune diseases, there is a dysfunction in Tregs, leading to an exaggerated inflammatory response. The ketogenic diet also reduces the expression of pro-inflammatory cytokines. The ketogenic diet also decreases the expression of pro-inflammatory cytokines, such as tumor necrosis factor alpha, TNF-alpha, and interleukin-6. These cytokines play central roles in perpetuating inflammation in autoimmune diseases. By suppressing these signaling molecules, the diet can mitigate the severity of autoimmune inflammation. Specific autoimmune diseases and the ketogenic diet. Several viral studies have investigated the impact of the ketogenic diet on specific autoimmune diseases, with encouraging results. Multiple sclerosis. Multiple sclerosis is an autoimmune disease where the immune system attacks the myelin sheath surrounding nerves. Clinical trials have shown that the ketogenic diet can reduce the frequency and severity of MS flare-ups, possibly due to its ability to reduce neuroinflammation and promote neural repair. Ketosis may also increase levels of brain-derived neurotrophic factor, BDNF, which is crucial for the survival and repair of damaged neurons. Rheumatoid arthritis. In studies with animal models and humans, the ketogenic diet has shown to reduce joint inflammation and the levels of autoantibodies characteristic of rheumatoid arthritis. The weight loss induced by the diet may also help reduce the load on the joints, providing additional relief to patients. Systemic lupus erythematosus, SLE, is a systemic autoimmune disease affecting multiple organs. While human data is limited, animal studies suggest that the ketogenic diet can reduce the production of autoantibodies and the inflammation associated with SLE. This is partly due to the diet's ability to modulate the immune response and protect target organs from autoimmune damage. Hashimoto's disease. In Hashimoto's disease, the immune system attacks the thyroid gland, leading to hypothyroidism. Preliminary studies indicate that the ketogenic diet may help modulate the immune response against the thyroid, as well as improve mitochondrial function, which is essential for thyroid health. Systemic and hormonal effects of the ketogenic diet. Autoimmune diseases are often associated with metabolic disorders, such as insulin resistance, obesity, and dyslipidemia. The ketogenic diet can improve these aspects by promoting greater insulin sensitivity and facilitating weight loss. Additionally, the ketogenic diet can positively affect the hypothalamic pituitary adrenal axis, helping regulate cortisol levels, a stress hormone that, when chronically elevated, can worsen autoimmune diseases. The diet also influences the secretion of other hormones, such as ghrelin and leptin, which play roles in regulating appetite and inflammation. Clinical and practical implications. Although the benefits of the ketogenic diet in managing autoimmune diseases are promising, its implementation requires caution and personalization. The initial adaptation to ketosis can be challenging, causing side effects such as the keto flu, such as fatigue, nausea, and gastrointestinal disturbances. Medical supervision is essential, especially in patients with multiple comorbidities. Electrolyte supplementation, such as sodium, magnesium, and potassium, is crucial since the diet can lead to increased excretion of these minerals by the kidneys. Including anti-inflammatory foods, such as omega-3 rich fish, avocados, and olive oil, can also enhance the positive effects of the ketogenic diet. Conclusion and future perspectives. The ketogenic diet represents an innovative therapeutic approach to the treatment of autoimmune diseases, combining metabolic and immunological effects to reduce inflammation and modulate the immune system. Despite promising results, more controlled clinical trials are necessary to solidify its use across various autoimmune conditions. As part of an integrative treatment, which may include vitamin D modulation, correction of intestinal dysbiosis, and anti-inflammatory strategies, the ketogenic diet has the potential to transform the management of autoimmune diseases. In the future, we anticipate seeing the ketogenic diet as a central component of the therapeutic arsenal aimed at improving the quality of life and clinical outcomes for these patients. At the end of this chapter is a figure that demonstrates how leaky gut syndrome is a root cause of autoimmunity. Here we can appreciate the following explanation to this figure. Bear in mind that 80% of our immune system is found in the intestinal lining. An important structure that controls the gut's permeability is regulated by our tight junctions. Explanation of figure. Tight junctions are complex multi-protein junctions whose primary function is to prevent the leakage of solutes, chemicals, toxins, lipopolysaccharides, lectins such as gliadin found in gluten. They effectively seal the paracellular pathway, ensuring that substances cannot pass through the intracellular space. However, it's important to note that tight junctions can also exhibit some permeability, forming selective channels that allow the passage of small cations, anions, or water. Gliadin, a lectin derived from gluten, has the ability to impair the function of tight junctions. When gliadin is absorbed by enterocytes, it leads to the upregulation of a protein called zonulin. Zonulin, in turn, interferes with the connections between the proteins occludin and claudin, causing an increase in intestinal permeability. This disruption in tight junction integrity can result in the passage of substances that would normally be restricted, potentially leading to gastrointestinal problems and other health concerns. Note: vitamin D inhibits the synthesis of zonulin. Chapter 10: The Ketogenic Diet and Cancer. The ketogenic diet as an adjuvant in cancer treatment. Concept and rationale. The ketogenic diet, characterized by high fat intake and low carbohydrate intake, has been studied as a complementary therapeutic approach in cancer treatment. Its primary goal is to alter cellular metabolism by promoting ketosis, where energy is primarily derived from ketone bodies rather than glucose. This metabolic shift aims to impact the growth of cancer cells, which often heavily rely on glucose for survival. How ketosis affects cancer cells. Glucose deprivation. Many cancer cells depend on aerobic glycolysis Warburg effect for energy production, even in the presence of oxygen. By limiting glucose availability through the ketogenic diet, the metabolic environment becomes less favorable for tumor growth. Use of ketone bodies. Normal cells can adapt to using ketone bodies as an energy source, but many cancer cells are metabolically inflexible. This inability to utilize ketones makes them more vulnerable to glucose deprivation. Selective metabolic stress. The ketogenic diet can induce selective metabolic stress in cancer cells, leading to mitochondrial dysfunction and, in some cases, apoptosis, programmed cell death. Benefits of the ketogenic diet in the context of cancer. Reduction of chemotherapy side effects. The ketogenic diet can help minimize adverse symptoms of chemotherapy, such as nausea, fatigue, and loss of appetite. Promoting greater treatment tolerance. Improvement in quality of life. Patients on the ketogenic diet often report improvements in overall well-being, increased energy, and better weight control during aggressive treatments. Potential synergy with other treatments when combined with conventional therapies such as chemotherapy and radiotherapy. The ketogenic diet may potentially enhance the effectiveness of treatments by maximizing the vulnerability of cancer cells. Clinical studies and scientific evidence. Review of preclinical and clinical studies. Preclinical studies. Animal models have shown that the ketogenic diet can reduce tumor growth in various types of cancer, including glioblastoma, breast cancer, and melanoma. These studies suggest that ketosis can create a hostile environment for malignant cell growth, impeding their proliferation. Clinical trials in humans. Preliminary clinical trials in humans suggest that ketogenic diet can improve response to conventional treatment and increase survival in some cancer patients. However, the effectiveness of ketogenic diet appears to be dependent on the type of cancer, the stage of disease progression, and the individual metabolic profile of the patients. The combination of the ketogenic diet with conventional treatments and other metabolic interventions represents a promising area of research that, with further studies, may establish this strategy as a valuable tool in the integrated management of cancer. Successful use cases. Glioblastoma. Glioblastoma is an aggressive type of brain tumor with limited therapeutic options. Clinical trials have shown that the ketogenic diet, when combined with conventional treatments, can improve survival rates and reduce tumor progression in some patients. Breast and prostate cancer. There is also evidence suggesting that the ketogenic diet may play an adjunctive role in hormone-dependent cancers, such as breast and prostate cancer, by reducing insulin and IGF-1 levels, which promote tumor growth. Limitations and considerations. Individual differences. The response to the ketogenic diet can vary widely between individuals, depending on factors such as genetics, cancer type, and metabolic state. Need for further research. Although preliminary results are promising, more controlled clinical studies are essential to determine the efficacy, safety, and best practices for implementing the ketogenic diet in cancer treatment protocols. Combined use of ketosis, metabolic therapy, and hyperbaric oxygen therapy. Combined therapeutic approaches. The combination of ketosis with other metabolic therapy strategies and auxiliary treatments, such as hyperbaric oxygen therapy, has been explored as a way to maximize therapeutic effects and inhibit tumor growth more effectively. Metabolic therapy, synergy with the ketogenic diet. Metabolic targets. Metabolic therapy aims to alter the energy environment of tumor cells, making them more susceptible to treatment. Ketosis can enhance this effect by depriving the cells of glucose and forcing the use of ketone bodies, which many tumor cells cannot effectively metabolize. Inhibition of tumor growth. The combination of ketosis with metabolic therapies, such as the use of glycolysis inhibitors, can create a hostile environment for tumor growth, promoting selective apoptosis of cancer cells. Hyperbaric oxygen therapy, enhancing therapeutic effects. Increased oxygenation. Hyperbaric oxygen therapy increases oxygen levels in tissues, which can enhance treatment efficacy by reducing tumor hypoxia, a factor that promotes treatment resistance and cancer progression. Synergistic effects with ketosis. Ketosis, combined with oxygen therapy, can create a severe metabolic stress environment for tumor cells, potentially limiting their ability to survive and proliferate. Integrated protocols. Development of personalized protocols. The integration of ketosis with hyperbaric oxygen therapy and other metabolic interventions must be carefully monitored and adjusted as needed. Each patient requires a personalized protocol, taking into consideration the type of cancer, disease stage, and response to treatment. The LGS protocol includes a specific metabolic therapy program and has a specific anti-cancer metabolic guide that is used exclusively for oncology patients. This is an in-depth, multifaceted approach that involves 3 levels of therapy, including a specific ketogenic diet, alongside with a series of supplements, high-dose vitamin D protocol, intravenous high-dose vitamin C and alpha-lipoic acid protocol, hyperbaric oxygen therapy alongside with detox protocols. The 3 main pillars of the LGS protocol reside in 1, microbiome modulation, 2, immune modulation, and 3, epigenetic compensation. End of Chapter 10. Chapter 11. Nutritional considerations and supplementation. Micronutrients and essential minerals in the ketogenic diet. A ketogenic diet, known for being high in fats and very low in carbohydrates, can provide many benefits, including optimizing fat burning and improving metabolic function. However, like any restrictive eating plan, there can be challenges in ensuring adequate intake of all essential micronutrients. Micronutrients, such as vitamins and minerals, play crucial roles in maintaining health. In the ketogenic diet, some micronutrients may be harder to obtain due to the limitation of certain food groups, such as carb-rich fruits and whole grains. Therefore, it is important to ensure adequate intake of the following nutrients: magnesium, essential for energy metabolism, muscle function, and bone health. Keto-friendly sources include spinach, avocado, and nuts. Supplementation may be necessary if there are signs of deficiency, such as muscle cramps or fatigue. Potassium, important for electrolyte balance, blood pressure regulation, and muscle function. Good sources include avocado, salmon, and leafy greens. Potassium intake in a ketogenic diet can be insufficient, requiring attention. Sodium, often lost in large amounts during ketosis due to reduced insulin levels and increased renal excretion of sodium. Adequate sodium replacement is crucial to avoid side effects such as dizziness and weakness. Calcium, while less directly impacted by the ketogenic diet, low dairy intake in some variations of the diet can reduce calcium intake. include keto-friendly calcium-rich sources, such as leafy green vegetables and fish with edible bones. Supplementation to optimize ketosis and prevent deficiencies. Proper supplementation can be an important complement to the ketogenic diet, helping to optimize ketosis and prevent nutritional deficiencies, and must be taken accordingly. Some recommended supplements include multivitamin. A high-quality multivitamin can help fill nutritional gaps, especially for those struggling to get all micronutrients from food sources. Omega-3, supplementation with omega-3 fatty acids, such as fish oil, can be beneficial to balance omega-6 fatty acid intake, promoting cardiovascular health and reducing inflammation. Vitamin D3, essential for bone and immune health. Vitamin D levels may be insufficient, especially in individuals with limited sun exposure. Supplementation is recommended based on individual serum levels. Patients who take vitamin D3 follow the LGS protocol guidelines. B-complex. B vitamins play important roles in energy production and can be helpful in optimizing metabolism during the adaptation to ketosis. Use of MCTs, exogenous ketone salts, and electrolytes. Efficient ketosis depends on adequate fat intake, and this is where medium-chain triglycerides MCTs come into play. MCTs are rapidly metabolized by the liver and converted into ketones. MCT oil can be an excellent addition to a ketogenic diet to boost ketone levels and provide a quick source of energy. It can also be helpful for those undertaking extended fasting, aiding in maintaining ketosis. In addition to MCTs, exogenous ketone salts are a popular tool for inducing or maintaining ketosis. They provide ketones directly to the body, which can help improve mental clarity, increase energy, and reduce the initial symptoms of transitioning into ketosis, such as keto flu. However, they should be used in moderation and as a complement to the diet, not as a substitute for proper eating habits. Maintaining electrolyte balance is essential on a ketogenic diet. Water and electrolyte loss, such as sodium, potassium, and magnesium, can occur more rapidly as the body enters ketosis. Electrolyte supplements are often necessary to prevent the side effects of imbalances, such as fatigue, headaches, and muscle cramps. It is important to adjust the intake of these minerals daily, especially during extended fasting or intense physical activity. Conclusion. The ketogenic diet and prolonged fasting can offer a range of metabolic benefits, but it is crucial to pay attention to nutritional needs to ensure the body is well nourished and balanced. Supplementing with micronutrients, strategically using MCTs and exogenous ketones, and carefully managing electrolytes are important aspects of optimizing the ketogenic experience and maintaining overall health. At the end of this chapter, you will find a list of supplements that are commonly used in the LGS protocol. Please be advised that patients must undergo thorough medical evaluation before starting the protocol. End of Chapter 11. Chapter 12. Challenges and Solutions in the Ketogenic Diet. Overcoming weight loss plateaus. Understanding plateaus in the ketogenic diet. Weight loss plateaus are common during the ketogenic diet and occur when the body adapts to the new eating regime, causing fat loss to slow down or even stop. This can be frustrating for many who adhere to the ketogenic diet with the goal of losing weight. Strategies to overcome plateaus. Intermittent fasting. Integrating intermittent fasting into the ketogenic diet can help break plateaus by stimulating metabolism and promoting increased fat burning. Cycles like 16 hours of fasting with an 8-hour window for eating during the week, alongside fasting for 24 hours once or twice a week, can be very effective. Carbohydrate refeed meals, refeeds. Introducing a controlled increase in carbohydrate intake on certain days can help boost metabolism and resensitize the body to weight loss. Macro monitoring, reassessing macronutrient intake by adjusting levels of fat, protein, and carbohydrates may be necessary. Some individuals may need to reduce total caloric intake or increase protein consumption to maintain a caloric deficit. Exercise strategies to overcome plateaus. Strength training. Incorporating resistance or weight training can increase lean muscle mass and boost metabolism. High-intensity interval training, also called HIIT, is effective for burning fat and can be included to break weight loss plateaus by stimulating metabolism for hours after exercise. Adjusting the diet for different goals. Athletic performance. Adjustments for ketogenic athletes to enhance athletic performance. It's important to adapt protein and carbohydrate intake to support energy demands. Athletes may benefit from a cyclical keto approach, where small increases in carbohydrates are used on days with intense training. Use of MCTs and exogenous ketones for energy. Athletes can use MCTs and exogenous ketones as a quick energy source to sustain high-intensity workouts and improve recovery. Mental health and cognitive function. Ketones as fuel for the brain. The ketogenic diet has been associated with improved mental health and cognitive function. Using ketone bodies as an energy source can enhance mental clarity, focus, and mood, particularly for those suffering from neurodegenerative or mood disorders. Optimizing ketosis for brain health. Maintaining consistent levels of ketosis, along with supplementation of essential nutrients such as omega-3 fatty acids and phosphatidylserine, can optimize brain health. Longevity and healthy aging. The ketogenic diet and caloric restriction. Studies suggest that ketosis, combined with caloric restriction, may promote longevity by reducing chronic inflammation and increasing autophagy. A cellular renewal process. Anti-aging supplements. Supplements such as antioxidants, resveratrol, coenzyme Q10, and NAD precursors can be incorporated to support longevity and cellular health in individuals following a ketogenic diet. Adapting the ketogenic diet to lifestyle and individual needs. Adapting the ketogenic diet to daily life. Meal planning and preparation. Proper meal planning is essential for maintaining the ketogenic diet day to day. Preparing high-fat, low-carb foods in advance, such as meats, eggs, avocados, and keto-friendly snacks, can facilitate adherence to the diet. Flexibility for various routines. For individuals with unpredictable schedules or busy lifestyles, the ketogenic diet can be adapted using strategies such as portable meals, keto snacks, and flexible fasting. Personalizing the ketogenic diet for different profiles. Type 2 diabetes and metabolic syndrome. The ketogenic diet can be tailored for individuals with insulin resistance and metabolic syndrome, focusing on reducing carbohydrates to keep blood sugar levels controlled. Women and hormones. For women, especially during hormonal transitions such as menopause or pregnancy, adjustments in macronutrient and calorie intake may be necessary to support hormonal balance and overall health. Tips for maintaining motivation. Regular monitoring of results. Tracking ketosis levels with methods such as blood ketone measurements or urine ketone tests can be motivating by showing the physical and mental progress achieved. Tools like food diaries and tracking apps can be used to monitor nutritional intake and progress. Variety and creativity in meals. Keeping the ketogenic diet interesting, with a variety of creative recipes and tasty food options, helps avoid dietary monotony and enhances long-term adherence. End of Chapter 12. Chapter 13. The ketogenic diet for specific populations. Ketogenic diet in children. Ketogenic diet in the treatment of pediatric epilepsy. The ketogenic diet has been widely used in the treatment of drug-resistant pediatric epilepsy, with studies showing significant reductions in seizures in many children. History and clinical application. The ketogenic diet was developed in the 1920s as a therapeutic approach for pediatric epilepsy. It remains a key dietary therapy for children who do not respond to conventional treatments. Safe implementation. For children, the ketogenic diet must be supervised by a multidisciplinary team, including pediatricians, neurologists, and nutritionists, to ensure proper growth and development. Adequate caloric intake, protein, and micronutrients are crucial to prevent nutritional deficiencies. Note: more than 1,500 children have been enrolled in our ketogenic diet program for seizures. Johns Hopkins developed the modified Atkins diet in 2002 as a treatment for adolescents and adults, and opened the world's first adult epilepsy diet center. Other potential benefits in children. In addition to epilepsy, the ketogenic diet has been studied as an intervention for other neurological conditions in children, such as autism and developmental disorders. Due to its neuroprotective effects and potential improvement in cognitive function. Note, here's why. It eliminates gluten and casein, which can cause symptoms similar to autism. It promotes the use of ketones as an energy source, which improves brain function in various ways affected by autism. It helps calm the overactive nervous system that most children with autism have. It improves gut health, which has an extremely positive impact on behavior and brain health. Risks and considerations. It is essential to monitor potential adverse effects in children, such as hypoglycemia, dehydration, and deficiencies in nutrients like vitamins and minerals. Ketogenic diet for the elderly, healthy aging and metabolism. As people age, metabolic changes such as insulin resistance, muscle loss, and cognitive decline become more prevalent. The ketogenic diet can offer several benefits for older adults, including improvements in body composition, glycemic control, and brain health. Muscle preservation. A significant concern for the elderly is sarcopenia, muscle loss. To counteract this, protein intake should be adequate and complemented by resistance exercise. Ketosis can help preserve lean muscle mass and enhance mitochondrial function. Cognitive health and neuroprotection. The ketogenic diet may have neuroprotective effects that help combat neurodegenerative disorders like Alzheimer's and Parkinson's by providing an alternative energy source for the brain that is less dependent on glucose. Special considerations for the elderly. Cardiovascular health monitoring. Although the ketogenic diet is high in fats, it's important to choose healthy fat sources, such as omega-3s and monounsaturated fats, to maintain cardiovascular health in older adults. Electrolyte and micronutrient supplementation, hydration, and electrolyte replacement are crucial for older adults on a ketogenic diet, as reduced insulin levels can increase sodium and potassium excretion, leading to dehydration and electrolyte imbalances. Ketogenic diet for athletes, metabolic adaptation, and athletic performance. For athletes, the ketogenic diet provides an approach to optimize the use of fats as fuel, especially in endurance sports, where the constant availability of energy from fat reserves can be advantageous. Adaptation to fat burning. The process of adapting to fat burning can take several weeks to months, and athletes may initially experience a drop in performance during the transition to ketosis. However, after this adaptation phase, many report increased endurance and improved recovery. Endogenous ketones and MCTs. Athletes can use MCTs, medium-chain triglycerides, and exogenous ketones as quick energy sources to support high-intensity activities or competitions while maintaining ketosis. Adjustments for strength and power athletes. For sports requiring strength and power, such as weightlifting, sprints, and combat sports, adjusting carbohydrate intake may be necessary to provide immediate energy during intense training or competitions. Strength athletes might opt for a cyclical ketogenic diet (CKD) or targeted ketogenic diet (TKD), where small amounts of carbohydrates are consumed at strategic times. Maintaining muscle mass. Ensuring adequate protein intake is essential for preserving muscle mass in athletes, particularly in strength sports where muscle tissue is crucial for performance. Benefits for recovery and reducing inflammation. The ketogenic diet can help reduce post-exercise inflammation, promoting faster recovery. Consuming anti-inflammatory foods rich in omega-3, along with ketosis, can help athletes recover more quickly from intense training and prevent injuries. End of Chapter 13. Chapter 14. The importance of sleep in the ketogenic diet. Sleep plays a crucial role in overall health and bodily function. For those following a ketogenic diet, adequate sleep is essential to optimize the metabolic, hormonal, and cognitive benefits of this nutritional approach. In this chapter, we will explore the importance of sleep in the context of the ketogenic diet, how it influences weight loss, hormonal regulation, and mental performance, and provide tips to improve sleep quality during ketosis. Sleep and metabolic regulation. The ketogenic diet promotes the use of fat as the primary energy source by drastically reducing carbohydrate intake and increasing healthy fat consumption. For the body to make this transition efficiently, sleep plays a vital role. During sleep, the body performs important cellular recovery and hormonal regulation processes that are crucial for adapting to ketosis. Sleep deprivation can impair glucose metabolism and increase insulin resistance, making it harder for the body to burn fat. Studies show that lack of sleep is associated with elevated cortisol levels, the stress hormone, which can block fat burning and promote fat storage, particularly in the abdominal area. Sleep and hunger hormones. Sleep also influences the production and regulation of hormones that control appetite, such as ghrelin and leptin. Ghrelin, known as the hunger hormone, increases appetite and signals the body to consume more calories. On the other hand, leptin is responsible for signaling satiety and reducing hunger. When a person does not get enough sleep, ghrelin levels increase and leptin levels decrease, leading to increased appetite, especially for carbohydrate-rich foods. For those on a ketogenic diet, inadequate sleep can result in a greater temptation to consume off-limit foods like sugars and processed carbohydrates, which can disrupt ketosis and hinder progress on the diet. Sleep and ketosis. During sleep, the body continues to burn fat for energy, particularly in people who are in ketosis. The overnight fast is a crucial period for maintaining the state of ketosis, as the body continues to rely on fat reserves as the primary fuel source. However, lack of sleep can interfere with this process. Insomnia and fragmented sleep can lead to increased glucose levels and decreased production of ketone bodies, making it more challenging to maintain ketosis. Additionally, the adaptation to ketosis may initially cause sleep disturbances, such as insomnia or early waking, as the body adjusts to the new energy source. This phenomenon, known as keto adaptation, is usually temporary but can be alleviated with proper sleep hygiene strategies. Sleep and cognitive performance. The ketogenic diet is widely known for its benefits on cognitive performance, including improved mental clarity, memory, and focus. However, these benefits can only be fully realized if sleep is adequate. During deep sleep, the brain performs essential processes of cleaning and memory consolidation, which are fundamental for cognitive function. Individuals following the ketogenic diet who do not prioritize sleep may experience brain fog, irritability, and difficulty concentrating. Therefore, adequate sleep is an indispensable part of maximizing the positive neurological effects of ketosis. Tips for improving sleep on a ketogenic diet. To optimize sleep during the ketogenic diet, it is important to adopt practices that promote restorative rest. Maintain a consistent sleep schedule. Going to bed and waking up at the same time every day helps regulate the biological clock and improves sleep quality. Limit caffeine intake. Reducing caffeine consumption in the afternoon and evening can prevent insomnia and facilitate falling asleep. Exposure to natural light. Exposure to natural light during the day helps regulate circadian rhythms, while limiting exposure to blue light from electronic devices at night aids melatonin production, the sleep hormone. Adequate electrolyte intake. During adaptation to ketosis, electrolyte loss can cause muscle cramps and sleep disturbances. Ensuring adequate intake of sodium, magnesium, and potassium can help prevent these symptoms. Practice relaxation before bed. Relaxation techniques, such as meditation, deep breathing, or warm baths, can help calm the mind and prepare the body for restorative sleep. Conclusion. Sleep plays a crucial role in the effectiveness of the ketogenic diet, directly influencing metabolism, appetite, ketosis, and cognitive performance. Prioritizing quality sleep is as important as diet and physical exercise for achieving and maintaining the benefits of this nutritional approach. By ensuring good sleep hygiene, those on a ketogenic diet can maximize their results and significantly improve their overall health and well-being. At the end of Chapter 14, a graph is displayed showing the relationship between cortisol and melatonin production and the hours that correspond to each other. Cortisol and melatonin, hormones regulated by the circadian rhythm. Cortisol and melatonin are hormones regulated by the circadian rhythm, but they peak at different times to synchronize the body's sleep-wake cycle. Cortisol, often referred to as the stress hormone, typically reaches its highest levels early in the morning shortly after waking. This increase helps promote alertness and prepares the body for the day ahead. On the other hand, melatonin, known as the sleep hormone, rises in the evening as natural light decreases, signaling to the body that it is time to relax and prepare for sleep. This opposing rhythm ensures that cortisol supports function and vigilance during the day, while melatonin facilitates restorative sleep, maintaining a balanced and effective circadian rhythm. End of Chapter 14. Chapter 15. Stress Management and the Ketogenic Diet. Stress is an essential adaptive response that prepares the body to face challenges and threats, but chronic stress can have profound detrimental effects on health. This chapter explores in detail the causes of stress, its pathophysiology, and how it can contribute to autoimmune diseases, metabolic disorders, changes in the gut microbiota, and even cancer. Additionally, we will discuss how the ketogenic diet and other holistic approaches can aid in stress management and address underlying causes. Causes of stress. Stress can be triggered by a wide range of factors, which can be classified as physical, emotional, and environmental. Physical stressors, injuries, chronic illnesses, intense physical exertion, sleep deprivation, and hormonal changes can induce stress in the body. Emotional stressors, anxiety, depression, interpersonal conflicts, workplace pressure, and financial concerns are common sources of emotional stress. Environmental stressors, pollution, excessive noise, climate changes, and other environmental factors can also contribute to stress. Pathophysiology of stress. The pathophysiology of stress is complex and involves several systems and processes in the body. Hypothalamic pituitary adrenal HPA axis. Stress activates the HPA axis, resulting in the release of hormones such as cortisol and adrenaline. The hypothalamus secretes corticotropin-releasing hormone CRH, which stimulates the pituitary gland to release adrenocorticotropic hormone ACH. ACH, in turn, stimulates the adrenal glands to produce cortisol. Cortisol, known as the stress hormone, cortisol has several functions, including energy mobilization, increasing blood pressure, and modulating the immune system. Chronic exposure to elevated cortisol levels can cause dysregulation in metabolism and immunity, adrenaline and noradrenaline. These hormones are produced by the adrenal glands and prepare the body for the fight-or-flight response by increasing heart rate, blood pressure, and glucose release. Inflammation and oxidative stress. Chronic stress can lead to systemic inflammation and oxidative stress. Increased production of pro-inflammatory cytokines, such as IL-6 and TNF-alpha, contributes to chronic inflammation and tissue degradation. Stress and autoimmune diseases. Chronic stress can trigger or exacerbate autoimmune diseases through the following mechanisms. Immunological dysregulation. Elevated cortisol levels can dysregulate the immune system, resulting in inappropriate activation of immune responses. This can lead to the attack of the body's own tissues, as seen in autoimmune diseases such as rheumatoid arthritis and lupus. Changes in gut permeability. Stress can increase gut permeability, allowing antigens and toxins to enter the bloodstream, which may trigger an autoimmune response. Activation of T lymphocytes. Stress can alter the balance between different types of T lymphocytes, favoring an autoimmune immune response. Stress and metabolic disorders. Chronic stress is associated with a range of metabolic disorders. Metabolic syndrome, characterized by abdominal obesity, hypertension, dyslipidemia, and insulin resistance. Stress can increase visceral fat deposition and insulin resistance. Type 2 diabetes, insulin resistance exacerbated by stress, can lead to the development of type 2 diabetes. Endocrine dysfunction. Chronic stress can cause hormonal imbalances, affecting lipid and carbohydrate metabolism. Stress and gut microbiota. Stress has a significant impact on the gut microbiota, contributing to dysbiosis and its consequences. Changes in microbiota composition. Stress can alter the diversity and composition of the gut microbiota, leading to an imbalance between beneficial and pathogenic bacteria. Increased gut permeability. Stress can compromise tight junctions, increasing gut permeability and allowing the translocation of pathogens and toxins. Gut-brain axis. Changes in gut microbiota can affect brain function and emotional state, contributing to symptoms of anxiety and depression. Stress and cancer. Chronic stress may be associated with the development and progression of cancer through several mechanisms. Chronic inflammation. chronic inflammation and oxidative stress can create an environment conducive to the growth of cancer cells. Altered immunity, stress can weaken the immune system, reducing the body's ability to detect and destroy cancer cells. Genetic regulation, stress can alter the expression of genes related to tumor growth and resistance to cancer therapies. Managing stress with the ketogenic diet. The ketogenic diet can be a valuable tool in managing stress. Reduction of inflammation. The ketogenic diet has anti-inflammatory properties that can help reduce inflammation associated with chronic stress. Stabilization of blood glucose levels. The ketogenic diet helps maintain stable blood glucose levels, which can prevent spikes and drops that exacerbate stress. Improvement of brain function. Ketones provide an alternative energy source for the brain, enhancing cognitive function and emotional resilience. Natural methods and holistic therapies for stress management. To address stress holistically and tackle its underlying causes, consider the following approaches. Meditation and mindfulness. Meditation and mindfulness techniques help reduce the stress response and promote mental calm, improving stress resilience. Regular physical exercise. Regular physical activity lowers cortisol levels and improves mood, helping counteract the negative effects of stress. Balanced nutrition. In addition to the ketogenic diet, a diet rich in antioxidants, vitamins, and minerals can help combat oxidative stress and inflammation. Nutritional supplements. Supplements such as magnesium, B-complex vitamins, and adaptogens like ashwagandha and rhodiola can help regulate the stress response and promote hormonal balance. Complementary therapies, acupuncture, therapeutic massages, and plant-based therapies can offer additional relief and promote emotional balance. Sleep and relaxation practices. Ensuring quality sleep and adopting relaxation practices, such as yoga and deep breathing, are essential for effective stress management. Conclusion. Effective stress management is crucial for overall health and can be significantly impacted by the ketogenic diet and holistic approaches. Understanding the causes and pathophysiology of stress, along with adopting strategies to address the root causes, can help promote a more balanced and healthy state of well-being. Integrating the ketogenic diet with natural methods and complementary therapies can maximize benefits in stress control and overall health, contributing to a healthier and more balanced life. End of Chapter 15. Chapter 16. Myths and facts about the ketogenic diet. Debunking common misconceptions. Myth 1. The ketogenic diet is a high-protein diet. Myth: many people believe that the ketogenic diet is based on high-protein consumption, similar to the Atkins diet. Fact: the ketogenic diet is actually a high-fat, moderate protein, and very low-carbohydrate diet. The primary goal is to induce ketosis, a state in which fat becomes the main fuel source rather than protein. Excess protein can actually hinder ketosis, as it may be converted into glucose through gluconeogenesis. Myth 2. The ketogenic diet causes muscle loss. Myth: a common concern is that carbohydrate restriction leads to muscle loss, especially in athletes and physically active individuals. Fact: studies show that once adapted to ketosis, the body becomes highly efficient at preserving muscle mass even on a low-carbohydrate diet. Ketone production provides an alternative energy source that preserves muscles during periods of carbohydrate restriction, and adequate protein intake helps maintain muscle mass. Myth 3. The ketogenic diet increases cholesterol and heart disease risks. Myth: there is a common fear that the ketogenic diet, being high in fats, drastically increases cholesterol levels and, consequently, heart disease risks. Fact: while total cholesterol levels may increase in some individuals, many studies indicate that the ketogenic diet tends to increase HDL, the good cholesterol, and reduce triglycerides, improving the overall lipid profile. Moreover, inflammation markers, which are more indicative of heart risks, often decrease on ketogenic diets. Myth 4. The ketogenic diet is unsustainable long-term. Myth: many people believe that the ketogenic diet is difficult to follow and unsustainable in the long run. Fact: the sustainability of any diet depends on individual adaptation and the support a person receives. Many adherents of the ketogenic diet successfully maintain it long-term. especially when they adapt meals to their food preferences and lifestyle. Studies show that the ketogenic diet can be sustained long-term with proper nutrition and monitoring. Myth 5. The ketogenic diet is nutrient deficient. Myth: some people claim that restricting carbohydrates leads to deficiencies in essential vitamins and minerals. Fact: while the ketogenic diet restricts certain carbohydrate-rich foods, such as fruits and grains, it can be perfectly balanced in terms of micronutrients by including low-carb vegetables, nuts, seeds, high-quality meats, and supplements when necessary. With proper planning, it is possible to meet all nutritional needs. Evidence-based facts. Fact: the ketogenic diet improves glycemic control. Studies show that the ketogenic diet is highly effective in controlling blood glucose and insulin resistance, making it a powerful tool for people with type 2 diabetes and metabolic syndrome. The reduction in insulin levels and the need for glucose control medications is a proven benefit. Fact: the ketogenic diet can promote weight loss. Numerous clinical trials demonstrate that the ketogenic diet promotes weight loss, often more effectively than conventional low-fat diets. The state of ketosis reduces hunger, improves satiety, and helps in burning body fat, especially visceral fat, which is metabolically harmful. Fact: the ketogenic diet has neuroprotective effects. The ketogenic diet was originally developed to treat epilepsy, and its neuroprotective effects have been documented in various neurological conditions. In addition to reducing epileptic seizures, research suggests that ketosis may be beneficial for neurodegenerative diseases such as Alzheimer's and Parkinson's by providing an alternative energy source for the brain. Fact: the ketogenic diet reduces systemic inflammation. Studies indicate that the ketogenic diet can reduce inflammatory markers in the body, such as C-reactive protein. Reduction in inflammation is one of the main mechanisms by which the ketogenic diet can benefit a range of chronic conditions, including autoimmune and cardiovascular diseases. Fact: the ketogenic diet supports mitochondrial health. Research shows that the ketogenic diet improves mitochondrial function by increasing energy efficiency and protecting cells from oxidative damage. This effect is particularly relevant for diseases such as cancer and metabolic disorders, where mitochondria play a central role. End of Chapter 16. Chapter 17, Final Considerations on the Ketogenic Diet. Summary of key points. Throughout this book, we have explored the ketogenic diet in depth, from its scientific foundations to its effects on different populations and health conditions. Here are the main points covered. Phases of adaptation to ketosis. We discuss the metabolic adaptation process to ketosis, including the initial symptoms of keto flu and strategies to ease the transition. We showed that over time, the body becomes more efficient at using ketones as an energy source, providing lasting benefits. Impacts on metabolic health. The ketogenic diet has demonstrated profound effects on improving insulin resistance, glycemic control, and reducing risk factors for cardiovascular diseases, as well as optimizing fat and ketone metabolism. Ketogenic diet and cancer. We explored the use of ketosis as an adjunctive metabolic therapy in cancer treatment. Clinical studies suggest that ketosis may help reduce tumor growth and increase the effectiveness of traditional therapies, such as chemotherapy, especially when combined with hyperbaric oxygen therapy. Challenges and solutions. We identified common challenges associated with the ketogenic diet, such as weight loss plateaus and the need for nutritional adjustments for different goals, such as athletic performance or mental health. Practical solutions were presented to help maintain the diet sustainably and adapted to individual lifestyles. Personalization of the ketogenic diet. We discussed the need to tailor the ketogenic diet for specific populations, such as children, the elderly, and athletes, highlighting that there is no one-size-fits-all approach. Debunking myths. We dispelled many common myths about the ketogenic diet, from fears of muscle loss to claims that the diet is unsustainable or dangerous long-term. We relied on scientific evidence to present a balanced and informed perspective. Future perspectives and advances in ketogenic science. The science behind the ketogenic diet is continually evolving. As new research emerges, we continue to learn more about how ketosis can benefit a variety of conditions, from metabolic to neurodegenerative diseases and cancer. Promising areas for future exploration include exploring ketosis as a metabolic therapy. Emerging evidence suggests that ketosis may enhance the treatment of chronic diseases such as epilepsy, cancer, Alzheimer's, and type 2 diabetes. The ketogenic diet is being studied as a tool to modulate metabolism and increase longevity. Advances in supplementation and support. New forms of ketosis support, such as exogenous ketone salts and advanced metabolic monitoring technologies, are becoming more accessible. These advancements help individuals enter and maintain ketosis more efficiently, offering new pathways for health optimization. Research in genetics and diet personalization. The integration of genetic data and individual biomarkers into personalized nutrition is gaining momentum. With the advancement of precision medicine, we will be able to tailor ketogenic interventions based on each individual's genetic needs, maximizing the benefits of the diet. Encouragement for personalized diet for longevity and well-being. The ketogenic diet is a powerful tool for improving metabolic health, increasing longevity, and supporting overall well-being. However, it is essential to remember that there is no one-size-fits-all solution. Personalizing the diet, taking into account factors such as genetics, lifestyle, health goals, and food preferences, is key to achieving optimal and sustainable results. The ketogenic diet can be adapted to meet individual needs at different stages of life and to support various health goals. Whether it's to improve glycemic control, support the treatment of chronic conditions, or simply promote healthy aging, ketosis can play a central role in the pursuit of longevity and well-being. We conclude with the hope that the information contained in these prior chapters herein inspires and empowers you to explore the benefits of ketosis in a mindful and personalized way, enabling you to make informed choices for your health and quality of life. The following chapter will explain the benefits of extended and prolonged fasting and how it should be done. At the end of this chapter, we can see a figure showing how the ketogenic diet can potentially be used as a therapeutic tool for addressing metabolic conditions. Autoimmune diseases and cancer, making the intestinal tract the main setting for the initiation of diseases process. Dr. Beltran commonly says, "The microbiome is the epicenter of human health. Treat it well and you shall enjoy a lifetime of longevity." End of Chapter 17. Chapter 18. Extended fasting, prolonged fasting, and its benefits combined with the ketogenic diet. Extended fasting, when combined with the ketogenic diet, has gained attention as an effective strategy for improving metabolic health, promoting longevity, and optimizing fat burning. While both fasting and the ketogenic diet are powerful on their own, their effects are amplified when combined, bringing numerous benefits to the body and mind. This chapter explores the advantages of extended fasting when paired with the ketogenic diet, highlighting its impacts on weight loss, brain health, metabolism, and more. What is extended fasting? Extended fasting is defined as abstaining from food for a longer period than traditional intermittent fasting. While intermittent fasting typically lasts between 16 to 24 hours, extended fasting can last from 36 hours to several days, depending on individual goals and health conditions. During extended fasting, the body undergoes a series of biological adaptations. Once liver glycogen stores are depleted, the body enters ketosis, where it starts using fatty acids and ketone bodies as its primary source of energy. This metabolic shift is beneficial for promoting autophagy, cellular regeneration, and fat burning. Benefits of extended fasting combined with the ketogenic diet. Enhanced fat burning. The ketogenic diet is already known for inducing a state of ketosis, where the body burns fat as its primary source of energy instead of carbohydrates. By combining this diet with extended fasting, the body is encouraged to enter ketosis more quickly and deeply. During extended fasting periods, the body ramps up lipolysis fat breakdown, accelerating weight loss and reducing body fat. Additionally, ketosis promoted by the ketogenic diet makes extended fasting easier, as the body is already adapted to burning fat for fuel, decreasing hunger pangs and fatigue. Autophagy and cellular regeneration. One of the main benefits of extended fasting is the activation of autophagy, a natural process where damaged cells are broken down and recycled by the body. This process is crucial for cellular renewal, protection against neurodegenerative diseases, and potentially slowing aging. The ketogenic diet itself promotes some level of autophagy, but extended fasting further intensifies this effect. Improved insulin sensitivity and metabolic health. The combination of extended fasting and the ketogenic diet is particularly effective in improving insulin sensitivity, helping to lower blood glucose levels and prevent or manage conditions such as type 2 diabetes. Without frequent insulin spikes, the body becomes more efficient in using energy and regulating blood sugar levels. This synergy between diet and fasting can promote optimal metabolic health. brain health, and neuroprotection. Both ketosis and extended fasting have positive effects on brain health. The brain can use ketone bodies as a more efficient energy source than glucose, which enhances mental clarity, focus, and cognitive performance. Moreover, extended fasting stimulates the production of neurotrophic factors, such as brain-derived neurotrophic factor (BDNF), which are crucial for the growth and survival of neurons. This can help reduce the risk of neurodegenerative diseases like Alzheimer's and Parkinson's. Reduction of inflammation and optimization of the immune system. Chronic inflammation is at the root of many diseases, including autoimmune diseases, cardiovascular issues, and cancer. Extended fasting combined with the ketogenic diet has been shown to effectively reduce inflammatory markers in the body. Fasting forces the body to detoxify and eliminate damaged cells, while ketosis reduces inflammation by providing a cleaner energy source. Additionally, fasting promotes the renewal of immune cells, helping to strengthen the immune system and enabling a better response to infections and diseases. Combining extended fasting and the ketogenic diet. While the combination of extended fasting with the ketogenic diet offers many benefits, it is important to approach this practice with caution and preparation. Here are some strategies to ensure success. Prior ketogenic adaptation. Before embarking on extended fasts, it's essential for the body to be well adapted to ketosis. This will make fasting easier since the body will already be used to burning fat for fuel, reducing carb cravings, and minimizing hunger. Proper hydration. During extended fasting, hydration is crucial. Drink water regularly and consider adding electrolytes such as sodium, potassium, and magnesium to avoid mineral imbalances. Metabolic monitoring. Track your glucose and ketone levels to ensure you are maintaining a healthy state of ketosis and that fasting is benefiting your metabolism effectively. Professional consultation. If you have any pre-existing medical conditions or are considering extended fasting for the first time, it is always recommended to consult a healthcare professional or a specialized nutritionist to ensure this practice is safe for you. The combination of extended fasting with the ketogenic diet is a powerful strategy to optimize metabolic health, promote longevity, and enhance brain and immune function. By entering ketosis through a low-carb diet and maintaining extended fasting periods, the body activates repair and regeneration mechanisms that promote overall health. However, it is important to approach this practice carefully, ensuring the body is well prepared and that adequate monitoring is in place. This combination can be an excellent tool to improve quality of life, provided it is done consciously and personalized for each individual. Difference between 16-hour versus 24-hour fasting and metabolic changes. The 16-hour fasting protocol, commonly known as the 16/8 method, involves fasting for 16 hours with an 8-hour eating window. This popular form of intermittent fasting induces several metabolic changes that offer health benefits. Glucose metabolism and insulin. Insulin sensitivity. During a 16-hour fast, insulin levels begin to drop, which aids in the mobilization of stored body fat for energy. Lower insulin levels also improve insulin sensitivity, crucial for regulating blood glucose levels. Fat burning. The body starts to deplete liver glycogen and transitions to using fatty acids as a primary energy source. Moderate ketosis. After 16 hours without food, the body may start producing small amounts of ketones, especially if the diet is low in carbohydrates. However, ketosis is not as significant as in longer fasts or strict ketogenic diets. Gut health. Gut repair. Fasting for 16 hours supports intestinal barrier repair and reduces intestinal inflammation, encouraging a healthy balance of gut microbiota by promoting the growth of beneficial bacteria. Autophagy stimulation. Cellular maintenance. Autophagy, the process by which cells recycle damaged components, slightly activated during 16-hour fasts, supporting cellular health and longevity. A 24-hour fast is a more extended form of food restriction, which amplifies some of the metabolic responses seen during a 16-hour fast. Greater glycogen depletion. After 24 hours of fasting, liver glycogen stores are largely depleted. This forces the body to use fatty acids more efficiently and rely on ketone bodies for energy. Fat burning becomes more pronounced, promoting weight loss and improving the lipid profile. Ketones and autophagy. The body enters a deeper state of ketosis after 24 hours of fasting, increasing circulating ketone levels in the blood. This state benefits not only the brain and nervous system but also optimizes autophagy, removing damaged or dysfunctional cells. Impact on gut microbiome. A 24-hour fast has a greater impact on the microbiome, promoting bacterial diversity and improving gut health. Studies show that longer fasts help restore microbial balance, especially in cases of dysbiosis. Immune response. Although stem cell renewal is not as significant in 24-hour fasts as in longer fasts, there is an initial activation of immune regeneration, promoting the elimination of compromised immune cells. Difference between 72-hour fasting against 7-day fasting and metabolic changes. 3-day fasting, significant immune regeneration. A 3-day fast triggers substantial regeneration of immune cells. During this period, the body eliminates old or damaged immune cells and stimulates the production of new hematopoietic stem cells, which give rise to more efficient and functional immune cells. Enhanced autophagy and cellular cleansing. Autophagy is strongly activated after 3 days of fasting, promoting deep cleansing of damaged cells, aiding in the removal of cellular debris, and fostering tissue repair. Microbiome modulation. During a 3-day fast, there is a noticeable change in the gut microbiome. Fasting promotes a less inflammatory gut environment, favoring the proliferation of beneficial bacteria and reducing intestinal pathogens. This benefits both gut and systemic health. 7-day fasting, complete immune renewal. After 7 days of fasting, the body undergoes a complete immune system renewal, regenerating new stem cells, which can be particularly beneficial for cancer patients. This renewal helps to strengthen the immune system and improve its ability to recognize and fight tumor cells. Significant reduction in systemic inflammation. A 7-day fast drastically reduces inflammation throughout the body, creating a less favorable environment for tumor growth. The reduction in inflammatory markers is a crucial advantage for patients dealing with cancer, particularly those whose conditions are dependent on chronic inflammation. Intestinal regeneration. During 7 days of fasting, considerable regeneration of the intestinal mucosa occurs, promoting healing of conditions such as leaky gut, common in cancer patients and those with other chronic illnesses. This regeneration enhances nutrient absorption and intestinal immune function. Profound impact on the microbiome. After 7 days of fasting, the gut microbiome undergoes a deeper transformation. The intestinal microbiota adapts to a new environment, promoting greater bacterial diversity, which is correlated with improved immune response and reduced risk of chronic inflammation. Prolonged fasting and its impact on cancer patients. Cancer patients can significantly benefit from combining prolonged fasting with a ketogenic diet, particularly regarding increased sensitivity to conventional therapies and overall improvement in metabolic and immune health. Energy deprivation of tumor cells. Prolonged fasting deprives tumor cells of glucose, forcing them to endure metabolic stress and impairing their ability to survive and grow. Increased treatment efficacy. Both fasting and ketosis can enhance the effectiveness of oncological treatments, such as chemotherapy and radiation therapy. Glucose deprivation and the presence of ketone bodies create a hostile environment for cancer cells, while healthy cells are protected. Immune system regeneration and protection. Renewal of the immune system after 3 and 7-day fasts strengthens the body's defenses, increasing its ability to identify and destroy cancer cells, and improving response to therapies. Reduction of tumor inflammation. Prolonged fasting reduces systemic and tumor inflammation, creating an environment less conducive to cancer progression and metastasis. The difference between 16-hour, 24-hour, and prolonged fasts of 3 to 7 days is significant in terms of metabolic changes, cellular regeneration, and impact on the microbiome. For cancer patients, this practice, especially when combined with a ketogenic diet, offers a powerful intervention, enhancing treatment response, promoting immune system regeneration, and creating a less favorable environment for tumor development. Now we shall talk about preparation and care during different fasting modalities. Engaging in prolonged fasting requires proper preparation and continuous care during the fasting period to ensure the process is both safe and effective. Preparation varies depending on the duration of the fast, and each modality requires special attention to ensure the body receives essential nutrients and adequate support throughout the process. Preparation and care during a 16-hour fast 16/8 protocol. The 16-hour fast is a lighter practice, but still requires some care to ensure that the body adapts in a healthy way. Preparation. Adjust your diet. In the days leading up to the 16-hour fast, focus on consuming foods rich in fiber, healthy fats, and quality proteins, while avoiding refined carbohydrates. Choose the eating window. Set an 8-hour window that fits your daily routine and allows for balanced nutrient intake. Hydration. Drink plenty of water in the days prior to the fast to ensure your body is well hydrated. During the fast, continuous hydration. Keep drinking water, herbal teas, or black coffee without sugar during the fast to help with satiety and hydration. Light activities. Engage in light physical activities such as walking or stretching to help maintain bodily balance without overloading the metabolism. Pay attention to sleep. Try to get adequate sleep, as sleep deprivation can increase hunger and make fasting more difficult to endure. Preparation and care during a 24-hour fast. The 24-hour fast requires greater preparation and control during the fasting period, as glucose levels may drop and the body may face metabolic challenges. Preparation. Progressive adaptation. If it's your first time fasting for 24 hours, try shorter fasts of 16 or 18 hours before progressing to longer periods. Last meal before the fast, have a meal rich in protein, healthy fats, and fiber. Avoid sugars and refined carbohydrates that can cause quick energy spikes and drops. Proper hydration. In the days leading up to the fast, increase your water intake and include natural sources of electrolytes, such as coconut water or light salty broths. During the fast, drink water and electrolytes. Stay hydrated with water, teas, or light broths. Consider adding a pinch of sea salt to your water to balance electrolytes, preventing cramps and dizziness. Light activities. Avoid intense exercise. Activities such as gentle yoga, stretching, or walking are beneficial for keeping the body active without overloading it. Focus on mental rest. A 24-hour fast can be mentally challenging. Use meditation or mindfulness practices to stay calm and reduce stress. Preparation and care during a 72-hour fast, 3 days. A 72-hour fast triggers benefits such as autophagy and cellular regeneration, but it also requires careful preparation and continuous attention to the body. Preparation. Transition to ketosis. In the days leading up to the 72-hour fast, adopt a ketogenic diet, rich in healthy fats and low in carbohydrates. This will allow the body to start using fat as its primary energy source, making fasting easier. Last meal. Ensure that your last meal before fasting is rich in proteins, healthy fats, and fibrous vegetables that prolong satiety. Hydrate and consume electrolytes. Increase your intake of water, bone broth, and electrolyte-rich foods before starting the fast. During the fast, maintain hydration and electrolytes. Drink water consistently and add sea salt or electrolyte supplements to prevent imbalances that may cause extreme fatigue or dehydration. Gentle activities. Engage in light activities such as walking or restorative yoga. Intense exercise can quickly deplete your energy reserves. Mental control. Prolonged fasting can bring moments of doubt and discomfort. Relaxation techniques, deep breathing, and meditation can help keep your mind calm and focused on the benefits of the process. Monitor your health. If you experience extreme weakness, persistent dizziness, or fainting, stop the fast and consult a doctor immediately. Preparation and care during a 7-day fast. A 7-day fast is a powerful practice with profound impacts on the body, such as immune system regeneration and microbiome modulation. However, it requires rigorous preparation and medical supervision. Preparation, mandatory prior ketosis. In the weeks leading up to the 7-day fast, follow a ketogenic diet to fully adapt your body to using fat and ketone bodies as its primary energy source. Pre-fast meal. Consume a meal rich in healthy fats, quality proteins, and fibers. Include foods that help prolong satiety and ease the beginning of the fast. Medical supervision. A 7-day fast should be done under medical supervision, especially for patients with conditions like cancer. Ensure that all vital parameters are being monitored. During the fast, hydration and electrolytes. Stay hydrated with water, teas, bone broths, and sea salt to balance electrolytes. This helps prevent muscle cramps, fatigue, and other symptoms of imbalance. Regular monitoring. Have regular consultations with your doctor or nutritionist during the fast to monitor your health and make adjustments if necessary. Gentle movement, light walks, gentle yoga, or stretches can be maintained to support mobility without overloading the body. Mental recovery activities. Use fasting as an opportunity for meditation, reading, relaxation, and focusing on mental and spiritual health. The mind can be a powerful ally in overcoming the physical challenges of fasting. Gradual reintroduction of food post-fast. When breaking the fast, food reintroduction should be gradual and controlled. Start with small amounts of liquids, broths, cooked vegetables, and light fats, such as coconut oil, before reintroducing solid proteins and carbohydrates. Final considerations. Proper preparation and care during fasts, whether 16 hours or 7 days, are crucial to ensuring the body remains balanced, healthy, and safe. Continuous hydration, maintenance of electrolytes, mental support, and careful reintroduction of foods post-fast are essential practices to maximize the benefits of each fasting modality, especially for patients using these fasts as part of therapeutic protocols, such as in cancer treatment. Clinical studies and cases. Clinical case number 1, glioblastoma multiforme. Summary. Context: the treatment of glioblastoma multiforme has been challenging with standard therapy, radiation, and chemotherapy with temozolomide. The ketogenic diet is widely used in treating refractory epilepsy in children, and, when administered in controlled amounts, may also affect energy metabolism in brain tumors. We report the case of a 65-year-old woman who presented with progressive memory loss, chronic headaches, nausea, and a multicentric tumor in the right hemisphere identified by magnetic resonance imaging (MRI). After an incomplete surgical resection, the patient was diagnosed with glioblastoma multiforme, with hypermethylation of the MGMT gene promoter. Methods. Before starting standard therapy, the patient underwent therapeutic fasting with only water, and followed a restricted ketogenic diet with a ratio of 4:1 fat. Carbohydrate protein, providing approximately 600 kilocalories per day. The restricted ketogenic diet was maintained during the standard treatment period and was supplemented with vitamins and minerals. Steroid medication, dexamethasone, was discontinued during the treatment. The patient was monitored with MRI and positron emission tomography with fluorodeoxyglucose. Results: after 2 months of treatment, the patient's body weight was reduced by approximately 20%. And no brain tumor tissues were detected with positron emission tomography or MRI. Changes in biomarkers showed reduced blood glucose levels and elevated urinary ketone levels. Evidence of tumor recurrence was found 10 weeks after discontinuation of the strict diet. Conclusion: this is the first confirmed report of glioblastoma multiforme treated with standard therapy combined with a restricted ketogenic diet. Since rapid regression of glioblastoma is rare in older patients following incomplete surgical resection and standard therapy alone, the response observed in this case may be partially attributed to the effects of the restricted ketogenic diet with caloric restriction. Further studies are needed to evaluate the effectiveness of restricted ketogenic diets, administered alone or in conjunction with standard treatment, as therapy for glioblastoma multiforme and potentially other malignant brain tumors. Clinical case number 2. Long-term effects of the ketogenic diet for cancer. Summary. The ketogenic diet has been studied as a potential aid for cancer patients, but its long-term effects are still under discussion. In a previous study, researchers observed positive outcomes in 37 out of 55 patients with advanced cancer who followed the ketogenic diet for at least 3 months between 2013 and 2018. These 37 patients had an average survival of 25.1 months, with 23.9% still alive after 5 years. The study also examined how the duration of the diet affected patient outcomes. Patients were divided into 2 groups: those who followed the diet for 12 months or more, and those who followed it for less than 12 months. On average, the group that adhered to the diet for more than 12 months maintained it for 37 months, while the group with less than 12 months maintained it for 3 months. After accounting for other factors, the group that continued the diet for a longer period showed a significantly better survival rate. In summary, maintaining the ketogenic diet for a longer period improved the survival chances of patients with advanced cancer. Note: here we can see images of a chest CT scan of a patient with colorectal cancer with pulmonary metastases, yellow arrows. A decrease in multiple bilateral pulmonary metastases is observed 4 years after the initiation of the ketogenic diet. Clinical case number 3. Effects of a ketogenic diet on tumor metabolism and nutritional status in pediatric oncology patients, 2 case reports. Article published in the Journal of the American College of Nutrition. Year of publication, 1995. Summary. The aim of this study was to place pediatric cancer patients into a state of ketosis, where the body uses fat instead of glucose for energy, to determine if this would reduce the quick availability of glucose to certain tumors, potentially impairing tumor metabolism without negatively affecting the overall nutritional health of the patient. Case report. Cleveland University Hospitals. 2 female pediatric patients with advanced malignant astrocytoma tumors were followed as outpatients for 8 weeks. Ketosis was maintained by consuming a diet based on 60% medium-chain triglyceride oil. Tumor glucose metabolism was assessed by positron emission tomography PET scan, comparing the uptake of fluorine 18,2-deoxy-2-fluorodiglucose FDG in the tumor before and after the study period. Within 7 days of starting the ketogenic diet, blood glucose levels dropped to low normal levels, and blood ketone levels increased 20 to 30 times. PET scan results showed an average reduction of 21.8% in glucose uptake at the tumor site in both patients. One patient experienced significant clinical improvements in mood and developed new skills during the study. She continued the ketogenic diet for an additional 12 months and remained disease-free. Although this diet does not replace conventional cancer treatments, these initial results suggest a potential clinical use that warrants further research. For the following cases, we have chosen to leave them for you, the reader, to explore and reflect upon. These stories are presented for you to delve into at your own pace and to draw your own conclusions from the information and insights shared. Now, as we transition to the closing of this journey, I want to take a moment to personally thank you for staying with us until this point. Your dedication and curiosity have brought you here, and for that, we are truly grateful. Up next, we will hear a few words of acknowledgement on behalf of Dr. Eduardo Patrick Beltran.
Hello everybody, this is Dr. Eduardo Beltran. I would like to go ahead and say the following. As we reach the end of this book, I want to express my deep gratitude for your dedication and commitment to exploring the realm of the ketogenic diet and prolonged fasting. Your interest and willingness to learn and transform your life are truly inspiring. Life is a path filled with choices, and medicine reflects our daily decisions and the changes we choose to adopt. With each step we take towards understanding how our gut microbiota influences our health, we move closer not only to a healthier life, but also to a deeper understanding of our own vitality. True healing lies not just in medications or isolated treatments, but in the harmony between body, mind, and spirit. It resides in the ability to modify our lifestyle, enhance our nutrition, and make conscious choices that resonate with our deepest essence. This is a process that requires courage, patience, and sincere commitment to one's own well-being. Modern and integrative medicine provides us powerful tools, but it is our continuous effort to implement these changes that can lead to true transformation. The journey to vibrant health is, at its core, an inner journey where the wisdom we acquire and the determination we show are the keys to unlocking the full potential of our body and mind. I sincerely thank you for joining me on this journey. I hope the knowledge shared here inspires and empowers you to make choices that not only promote your health, but also bring a new perspective on the power you have to create a full and healthy life. Remember, true healing is a reflection of internal transformation and the decisions we make to live a more balanced and conscious life. May your journey be filled of discoveries, growth, and above all, lasting well-being. With gratitude and best wishes, Dr. Eduardo Beltran.